Hello, my name is Kristen DeVideo. I want to welcome you and thank you for joining me on this learning opportunity. The purpose of this segment is to offer insight into how the New Hampshire Tobacco Helpline's call center, 1-800-QUIT-NOW, operates so that you and your patients have realistic expectations of the helpline services. All treatment services are evidence-based, and all quit lines adhere to similar standards of data collection. This module is one of 4 modules available through the New Hampshire Department of Health and Human Services to help you to work with patients and treat them for tobacco use. The time you spend watching this video will help you work with your patients more effectively, and you can stop or start this learning module at any time. You will receive a continuing education credit after you complete the assessment and evaluation of this lesson. Instructions are available on the website. After this educational activity, you will be able to describe the services available to you through the New Hampshire Tobacco Helpline and refer your patients to the helpline. You're probably wondering, are quit lines effective? Well, the short answer is yes. Tobacco treatment quit lines, like the New Hampshire Tobacco Helpline, offer your patients evidence-based treatments for smoking cessation. The 2008 update to the Public Health Service Clinical Practice Guideline for Treating Tobacco Use and Dependence presents a thorough analysis of tobacco treatment research. The evidence led to 3 conclusions. First, patients are more likely to quit successfully when a combination of therapies is applied, such as behavior counseling, along with nicotine replacement therapies, such as the patch or lozenge or gum. Second, patients are more likely to quit successfully when behavior counseling extends over time to 100 minutes. And lastly, patients are more likely to quit successfully when medications are taken for 8 weeks or more. In summary, tobacco treatment quit lines that follow the Centers for Disease Control and Prevention guidelines are positioned to provide intensive treatment by highly skilled counselors. Quit lines reduce barriers, they improve quit rates, and are cost-effective public health interventions when compared to traditional disease prevention or treatment interventions. The New Hampshire Tobacco Helpline services are provided to all New Hampshire residents at no cost. This service is paid for through the New Hampshire Department of Health and Human Services through a cooperative agreement with the Centers for Disease Control and Prevention and the State of New Hampshire General Funds. National Jewish Health's Hospital Health Initiatives Department is the tobacco treatment quit line vendor for 15 states, including New Hampshire, Massachusetts, Vermont, and Rhode Island. The call center is under contract with the New Hampshire Department of Health and Human Services to operate from 7 a.m. to 1 a.m. Eastern Standard Time. Over 100 quit coaches trained in cognitive behavioral therapy techniques and motivational interviewing skills staff the call center. Calls to 1-800-QUIT-NOW are answered electronically, identifying that the caller has reached the New Hampshire Tobacco Helpline, and services are offered in English or Spanish. Translation services are available in more than 50 other languages through the AT&T language line. Individuals seeking help quitting tobacco use can access these services in a number of ways. One way is to call 1-800-QUIT-NOW and speak with an intake specialist. The other is through the website, QuitNow-NH.org, and request a call from an intake specialist, or sign up for text messages, get quit tips, or have an access to a variety of quitting resources. The helpline offers a clinical portal for you to directly refer patients to the helpline, just like any other specialty referral that you might make. I will talk more later about the options you have to make a direct referral using the service called QuitWorks-NH. Regardless of how your patients connect with the helpline, they will receive effective tobacco treatment that is tailored to their needs. So what happens when someone calls 1-800-QUIT-NOW? For example, callers are asked if they are first-time callers, callers returning a message left by a quit coach, or if the caller is a clinician interested in information about the helpline services. Within seconds, a quit coach will answer live, identify themselves, and ask how they may help. The quit coach is logged into the New Hampshire database. Based on the caller's request, the quit coach will offer mailed print materials and invite the caller to complete an intake screener needed before coaching can begin and nicotine replacement therapy can be accessed. This screener takes 5 to 7 minutes to complete, gathering caller demographic information determining client's level of addiction using the Fagerstrom test for nicotine dependence, and the client stage of readiness to quit. Immediately after the intake screen is completed, the client is encouraged to stay on the phone for their first coaching session. It is important to note that during times of high call volume, such as during a national media campaign, the intake screener may be conducted by an intake specialist rather than a quit coach. If this is the case, the intake specialist will transfer the patient to a coach. This process will take 20 to 30 seconds of hold time before a quit coach will come on the line. Some callers decline and make an appointment for a later date. I am pleased to tell you that over 95% of New Hampshire clients completing an intake screener participate in a first coaching session. The first coaching session is up to 30 minutes to engage the client in motivational interviewing conversation. The first coaching session is to empower them to realize their inner strength for changing behaviors associated with tobacco use. Ideally, by the end of the first coaching session, the client has set a quit date and made an appointment for a check-in call around their quit date. For these 15-minute check-in calls, the quit coach calls the client at an agreed-upon day and time. There are 5 progress checks designed to offer support for preventing relapse and address issues around using nicotine replacement medicines. Now let's discuss the nicotine replacement medications offered to clients who participate in coaching. At the end of the first coaching session, the client will be offered a quit kit containing 2 weeks of patches and 2 weeks of either nicotine gum or nicotine lozenge to be sent by U.S. mail. At the end of the second coaching session, the same quit kit is offered. At the end of the third coaching session, 2 weeks of any one product is offered. Quit coaches are trained in screening clients for medical contraindications and also trained in effective dosing for over-the-counter nicotine replacement therapy products. There is a clinical advisor available for consultation should a quit coach need a decisional support. Clients with dental issues are assigned nicotine lozenge rather than gum that may harm dental inserts. Clients are verbally instructed on how to use the nicotine replacement therapy products, but an easy-to-read infographic comes in each quit kit on using the products. To summarize, whether a patient calls, emails, or is referred, the helpline responds with an intake assessment and encouragement to participate in the first counseling call, motivational interview techniques combined with cognitive behavioral therapy delivered by highly skilled quit coaches, a total of 100 minutes over 5 weeks. Next, I want to talk about QuitWorks New Hampshire and how this program compares with 1-800-QUIT-NOW. QuitWorks New Hampshire is unique and is specifically designed as a 2-way referral feedback portal for healthcare professionals. QuitWorks New Hampshire is HIPAA compliant for patient confidentiality. The QuitWorks New Hampshire referral portal is extremely flexible to accommodate all levels of referral technology. Quit coaches are assigned New Hampshire patients within 24 hours of receipt and make the first outreach call to the patient within a day. If the patient does not answer, the quit coach leaves a message and requests a callback from the patient. This sequence will take place 3 times in 3 days. Then the patient file is closed, and the feedback report to the provider states, unable to reach patient. The helpline can be used with or without a coach. Patients also have the option of quitting by accessing a free online program and receiving support through the web. However, working with a quit coach greatly increases your patient's chance of quitting. Here are some tips to help your patient successfully connect with a quit coach. Number 1, when offering the referral, tell the patient that the quit coach call is from 1-800-784-8669. Ideally, the patient could put this number into their phone contacts as quit coach, so instead of an unknown 800 number appearing, the caller ID will say quit coach. Number 2, a quit coach will send a confirmation fax thanking you for referring your patient. Whatever fax number is on the enrollment form will be the number the feedback is sent to. This is the reason workflow is so important, so that all practice staff are aware of QuitWorks New Hampshire. This way, the feedback is not lost or considered a miscellaneous item in the fax machine area. Number 3, if a patient insists that QuitWorks New Hampshire never tried to contact them, please call Teresa Brown or send her an email so she can immediately research this in the database. This complaint is not uncommon because of the quit coach incoming caller ID being an 800 number. Teresa's contact information is in this presentation and is also on QuitWorks-NH.org. Number 4. If you have questions or concerns relative to QuitWorks New Hampshire, we are able to help. We want patients to pick up the phone when a Quit coach calls, and we want providers to trust this resource. If your office is interested in participating in the QuitWorks New Hampshire e-referral system, please contact the New Hampshire Tobacco Prevention and Cessation Program. If your system is not ready to go electronic, QuitWorks-NH can accept fax referrals. This universal form can be used by any provider with any patient. Pediatricians can also use the universal form to refer a child's parent or guardian if they use tobacco and are interested in quitting. You can download the universal referral form and make copies as needed. Many healthcare centers and clinics and hospitals in New Hampshire have a customized QuitWorks-NH enrollment form. QuitWorks-NH is a secure process for referring patients and sending patient status reports back to referring providers. It is ideal for health systems utilizing electronic referral processes and meeting meaningful use to criteria. So, who uses QuitWorks New Hampshire? Over 200 New Hampshire physicians and allied health professionals already currently refer patients using QuitWorks-NH. This translates to over 5,000 patients having the opportunity to work with trained tobacco treatment specialists. Using QuitWorks-NH can help them overcome their nicotine addiction. The helpline has one of the highest success rates in the country, a 37% quit rate and a 90% participant satisfaction rate. As a provider, your brief intervention is the best motivator for your patient to quit tobacco use. Each intervention is a dose that over time will elicit a desire to quit response from your patient. However, QuitWorks New Hampshire will serve each patient that is referred to them regardless of their stage of readiness to quit. Thank you for participating. This concludes the module regarding the New Hampshire Tobacco Helpline. Thank you for taking the time to complete this module. To receive a Certificate of Completion, or CEU, for this lesson, you need to complete the two-part assessment. The links are at the QuitWorks New Hampshire website for you to click through to a survey.